I would say hospitals, clinics, and community are facing the challenges of just in terms of workload and priorities, and certainly patient experience is a huge part of where people want to be, although there's many barriers in the way of reaching that goal at this point.
I think in terms of understanding what has happened to patients, I mean, there's different tactics that I use in terms of interviewing the staff or even going back to the patient to get an understanding. But I think within our organization, we're still kind of in the infancy of patient experience where we have the basic things there. We have the satisfaction surveys.
Some of the key messages from the from the panel this morning when they talked about what they were doing with Patient Advisory Council. So one of the key things was really you have to be ready, and you have to be ready and able to engage people. If you bring people to the table and then you don't do what you're saying you're going to do, that's actually, it's harm. And there was a webinar that I saw that they talked about. Essentially a harmful thing is to engage people in that process and not act on it. But on the flip side, it really takes a lot of energy and it takes a lot of resource to truly engage people. So whether it's having at least one dedicated person or being able to help empower people so that they can participate in a way and to help create that culture change, it takes time and it takes effort and a lot of organizations just aren't in a place to invest in it, or they don't have the resources to invest in it. So I think across the country a lot of people don't necessarily share the vision, and that in and of itself is a barrier. But then even those who do don't necessarily, they're not in a place to truly enact it in a way that maybe in more consumer-driven systems or more already patient-centered systems are.
I believe the major challenge is that the way that care is delivered is centralized now. So the nurse is at their nurse station. That we need to drive FaceTime in the room. So what we'll do is we take the clinical workstation, put it in the room with this, and then the nurse is in there and can just pop the screen over to the patient screen and say, hey, here's what we're doing. And patient satisfaction comes when you have more contact. So we need to drive the physicians and the clinicians to the bedside and decentralize, healthcare in the clinics.
I think the three main challenges around patient experience is actually ensuring that we're looking at the continuum. So traditionally it's very easy to get very focused on the acute care side and the silos. So, really starting to look at the whole journey of care for a patient, family, resident, client, along the continuum, as opposed to looking at their care as episodic care. And I think traditionally we've, most of a patient's and family's care is provided outside of acute care facilities, yet a lot of our time is spent on those acute care facilities. So how do we look at what does client family centered care mean outside of the walls of there, and also help with those transitions and those transition points there. I think the other challenges is we've been a very provider-driven system, and so our challenges is to continue to make sure we bring patients and families or residents, if it's in long-term care, or clients in home care, to the table and to have them be part of decision making at every level of the organization. And we're seeing that happen, and we're seeing amazing results from that. But we're challenging the status quo around that, and it requires us to really push our preconceived assumptions. And that's always continue to work to do.
As I was mentioning in my session, I think one of the really big ones is helping people understand what their journey through the healthcare system will look like. So preparing them for the next step and understanding what it means for them to take that next step. So I would say that's one of the important ones. I think the second one is to understand how we can introduce and leverage technology to help them feel more in control of their journey and be a part of that journey, be actively engaged in the journey. And I think while technology is very prominent in healthcare in terms of planning for your next stage in your healthcare journey, self-care, we've not done as good a job as we could in terms of the use of technology. I think the third challenge would be understanding the diversity of the populations that we serve. We often apply a broad lens to our planning in terms of this will work for everyone, and we have to, I think, be able to customize our programs and our approach more to meet the diverse needs of our population.
Patient experience, as many other initiatives within the healthcare system, faces challenges, but I think there's significant momentum that has developed over the last few years to really move this forward. Some of the challenges are common to any other change. There are many stakeholders, patients of course, healthcare practitioners, and other individuals who support the healthcare system with respect to working within the hospital in a non-medical capacity, and of course families. So being able to ensure that communication is effectively being transmitted to all the different stakeholders is one challenge. The second, I would say, is capacity. There are many competing priorities for many people. And often people will say, well, how is this going to affect me? Is this something that I should be embracing? I'm so busy doing something else. So capacity, the ability to have enough time to embrace the changes and to be able to incorporate them into everyday life. And I would say the third, there's many challenges, but also many opportunities. The third is to ensure that we do get the right feedback, that we are listening, and that we are using the information that is helping to guide us in an effective way.